Hi everyone. Thank you for having me today. I'm so excited to be here. I brought a little bit of information to share with you all about our Us In Lupus program, and I hope you enjoy it. And don't let me forget at the end, I want you to hear a poem that we have that this poem wrapper put together, and it talks about lupus. And so I want you to really hear that because I think it's a really cool poem. Okay, so we're going to go ahead and get started because I know we're running behind a little bit. So one of the first things about taking care of yourself and managing your lupus is, make sure you're eating a healthy diet. Eating a healthy diet definitely gives you more energy. I'm not the poster child for a healthy diet, but I'm trying. So, but I do notice once I eat, more healthy, I definitely have more energy. And with lupus, we struggle with fatigue, right? So, healthy diet and exercise. And I know that sounds kind of crazy. Exercising can wear you out, but it actually helps you with your energy. So if you can somehow incorporate that into your day, it's a process, and we're all learning together. And so, make sure you're also getting your sleep. I think sleep is very underrated. So, so just remember to try to, manage your schedules and don't jam-pack them, and just make sure that you are resting and getting enough sleep, because that's when your body repairs itself, is when you're sleeping. Another important thing, and some of these things sound pretty simple, but if you reflect back and think about it, they really will help. So it's just that we tend to live a very busy life sometimes, and we just stop to reflect and think about some of the simple things that we can do that can really make a big impact and a big difference on ourselves, okay? So one thing, when I talk to patients a lot, I know a lot of patients get very frustrated with their healthcare physicians perhaps because maybe they don't feel like they're listening, or maybe the appointment is going by way too fast and you really didn't get a chance to ask your questions or share some symptoms. So one thing that I try to teach in a lot of my classes is if you can, and I'm going to show you how you can get this, but if you don't have a journal, I'm going to show you how you can get one. But if you even have a calendar, just start getting in the habit of jotting down what you feel like each day. And we actually have an app for your phone. It's called My Lupus app, My Lupus Log app. And it's on Android and on the Apple phone. And basically it will ask you, are you having a good day or a bad day? And then it'll ask you, how are you feeling that day? So you can jot down either on a journal like this, how you're feeling each day, come up with a coding system that works for you, and or you could do it in the app, and you can, chart in there how you're feeling. I'm having more joint pain than usual, or I'm more fatigued than usual. And what will happen, and you'll see it too, is you'll start to see a trend what's going on. And the great thing about that is your physician can see if you brought a calendar in or you shared with them that, for the last 2 months or 3 months, doc, I've kind of not been feeling well. Even though I am on a treatment plan that you put me on, more than half of the time I'm feeling awful and I'm not doing the activities that I typically do. So that's kind of a flag for your physician to really look at you and to look at what treatment plan they have you on, and perhaps they need to make an adjustment. So now, is anyone doing some kind of charting for their appointments before they go? Does anyone want to share real quickly? What do you do when you prepare to go for your physician's appointments?
I have the app.
Oh, okay.
So I use it. It's easier than taking a notebook with you because a lot of times you forget it. My phone I don't forget, so I just pop it open.
I love it. Thank you. I love that. So that's cool. Is anyone else using the app or heard of the app? My Lupus Log app. So it's on the Apple and it's on Samsung. So, and it will send you a reminder. So if you forget to chart how you're feeling that day, it will send you a reminder at whatever time you set. And I just think it's a cool way to keep track of how you're doing, because most patients, maybe you save up all your energy to get into that doctor's appointment, right? To put on your makeup, to get dressed up, and then you go into that appointment and the doctor thinks you look perfectly fine, or the nurse. And but then you forget. If you don't have it jotted down somewhere, you forget how you felt 3 months ago or even 10 days prior. So I really hope that people will begin charting and figuring out a system that works for them so you can have a much more productive communication with your physician, because any symptom that you leave out may be a very important symptom that they really need to know about. Okay, so one other thing that you may already be aware of, you should limit your sun exposure. You should cover up with sunscreen, a hat, long sleeves. And I know in the summertime that can be pretty warm, but I think you just have to figure out what's going to help you. And I've heard some people talk about there's these sleeves that you can put on your arms. So like if you're driving a lot, or if you're going to be out in the yard gardening or what have you, hat, your sleeves, and wear some long pants. That will help protect you and hopefully limit any flares that you may have. Yes, ma'am. Oh, she's talking to him. Okay. Also, another thing I found when I started talking to a lot of these patients, I've been talking to nurses and doctors and patients for the last 5 years, and I find out that a lot of times patients are afraid to ask for help. And I know that's a really big, that can be really hard. You want to ask someone to help you, a friend or a family member or a spouse or, a sibling. But sometimes when you're not feeling your best, please be empowered and ask for help. People do want to help. That's what I tend to find out from people is they do want to help. They just need to know how they can help. So, I have lupus as well, and my husband would not know what to do if I didn't directly say, I need you to do X, Y, and Z. So otherwise, I would just be sitting on the couch, not getting any of my needs met if I didn't mention it to him what type of help I need. Same thing with kids or a sibling. So be sure, don't be too proud, don't be afraid to ask, because people really do want to help, okay? And if you don't feel like you have a support system, you have your LFA, okay? You have a great chapter here. Reach out to your LFA members, and perhaps they can help you sort through and figure out how to help you. Okay, so this is my favorite slide because we did a survey. It was back in 2011. It was about almost 1,000 people in the lupus community, patients, doctors, family members. And what we found out, we really wanted to look at communication. How is the communication going on in the doctor's offices? Are patients being forthright, and are the doctors listening? And what they found out is 52% of patients reported that they're not completely being open and honest. They're not sharing all of what's going on, not all their symptoms, not all their questions. And then on the other hand, 72% of the physicians thought the patients were giving them all the information. And so what happens in that scenario is you're not getting the best possible outcome. So I know sometimes it's hard, we may forget, or maybe there's some tricky things where we feel uncomfortable speaking about. So we just have to figure out how you can really be open and honest. And if you want, if the journal's not helping, and maybe you need to bring another person to your appointment with you. Have another set of ears. Have someone who can help speak for you. Because there are some topics that might be really hard to have a conversation with your doctor about. So if you can find someone to go with you, I really advocate that, because they can ask some of the hard questions. Maybe if sometimes you feel like your physician or the staff isn't really helping you, maybe you want to bring someone with you who can help articulate that for you, because that's a really hard thing to do sometimes. If you feel like your treatment plan is not working for you, we kind of feel like we're a little bit intimidated by the doctor. We don't want to say, hey, doc, what you prescribed isn't working, right? But they really need to know and understand that. And if you're having a hard time articulating that, please bring someone to help you. Ask that physician or that healthcare provider, this treatment plan is not working. We need to find out what can work for my, loved one. Again, this slide is going to really talking about being open and honest in your doctor's appointments. That's the best way you can get the best support and the best outcomes for you. One thing I always tell my patients too is just remember, you as the patient, you the one who has lupus, you are the best resource for your best possible outcome. So always feel empowered. I know it can be intimidating in the doctor's office. It's intimidating for me sometimes because they're so specialized. I don't want to take up their time. but it's your time when you're in that appointment. So I want you to, if you're not already doing it, just really sit down the night before, and I'll show you some tools, and think back, about 10 days before you go into that appointment, and really think about how you've been feeling. What kind of symptoms have you been having? Have any symptoms disappeared? Or have you been feeling great? That's the other thing. If you've been feeling great, that's something you need to let your doctors know as well, because perhaps your treatment plan is working for you. So communicate, communicate, communicate. I think you're starting to see the theme here. This is a great slide too, in the sense that there's this physician, and I'm going to read her little quote right here, but the whole net of this is, if patients aren't communicating with her, it's a missed opportunity to really catch potentially a flare before it exacerbates into something larger. So she says, I have seen these challenges reflected in my clinical practice. It is critical that patients and physicians understand the importance of clear communication. It has implications for disease management. For example, if patients may not mention low-level disease activities, symptoms, they may consider it a normal part of living with lupus. So basically what she's saying right here, and I love that part, is when you're chronically ill with lupus or some other disease, sometimes you get used to the symptoms. And these symptoms to you just don't, you're like, that's just my lupus, not a big deal, right? And what could happen is in the background, because I'm sure you learned about it in the Lupus 101, there's invisible things going on inside your body. And if you're not communicating these subtle little symptoms or these subtle little things with your physician, you could really start having organ damage going on. And so you really need to be open, honest, and anything that you think is like, oh, that's just my lupus, go ahead and just jot it down, pass it through your physician so that you make sure you're not missing something important, because we want to catch those flares. We don't want you in the hospital. We want you to be healthy and living your life and doing really well. So she goes on to say that low-level disease activity can still cause organ damage. So that's another reason, too, why you really need to go to your appointments. Don't miss your appointments. If you miss an appointment, try to get back on the doctor's schedule as soon as possible. You really want to continue to be monitored by your physician, because what they do is they look at your blood, obviously, but they're also looking at your organ function. They want to make sure that your organ functions are still doing really well and that you're not running into any complications or any side effects from the medications. So try to always, always, always make your doctor's appointments. And the reason I'm stressing that is I've talked to so many patients who just stop going to their doctor. And as a nurse, that really scares me, because, we don't know what's going on inside, right? Until it's so bad that you end up in the hospital. So I don't want that to happen to anybody. I want them to talk to their doctors, go to your appointments. That way they can monitor you. Okay, again, communication. So what's the number one thing? Communication. Open and honest communication. And as simple as it sounds, sometimes I've seen myself, maybe you have too, you get into the doctor's office and everything goes out my mind. So does that ever happen to any of you? Yeah? Have you ever gotten into the doctor's office and left and said, oh, I should have asked this? Okay. So again, these little tricks: journal, your phone, the Lupus app. I've heard so many people come up with so many different ways that they track their symptoms and their questions. Okay, so this is a patient, Raina, and she's just re-emphasizing communication and how she's really worked to build a really strong relationship with her healthcare team, with her physician, and she feels like she's getting much better care now that she has that relationship. We see our rheumatologists, every 3 or 6 months? Yeah, so they're part of our life, so you really have to work on building that relationship. And if you feel like they're not listening or you don't feel like you're getting your questions answered, always ask the nurses in the practice first for some help. And if you feel like you're not getting the treatment that you need, you really need to start talking to, maybe utilize your primary care to help you find a physician that you can get into, okay? There's so many patients just stop going because of one reason or another, and I just don't want that to happen to anyone. I want you to get the best care that you can receive, and I want you to build that relationship with your rheumatologist. And some of you may be seeing wonderful nurse practitioners also who are in rheumatology practices. So be sure to bring your symptoms, your questions. Make sure you get everything you need in that 15 or 20-minute appointment. So when you leave, you know you're okay. You know, I don't want anyone to be sitting at home alone suffering and not feel like they're getting the treatment and the care that they need. Okay, so I'm just going to throw a question out to some of you, and please feel free to answer anyone. But I love this question. Think about whether there was a time that you did not report a symptom. And usually in all my talks, a couple of people raise their hands and they say they don't tell their doctor this particular symptom. So does anyone want to share? We're not judging. I just think it's interesting because I want to make sure that you will start feeling comfortable talking about things with your doctor. So does anyone want to share? Have they ever? Yes, ma'am.
When I first was diagnosed with lupus, when I went to the doctor, I thought, he must know everything. You know, I've just never been sick like that before. So I would just go there and he'd look at blood work and I'd, well, he must know everything that's wrong with me. But of course that's not so now that you have to get educated on it. But the one time particularly I went there is, I drove there and I couldn't remember how I got there.
Oh my goodness.
Because I had central nervous involvement and I didn't know that could happen. I said, I was so tired, I just can't remember how I got here. And of course, thank goodness he was a good rheumatologist, and he said, well, tomorrow you're going to the hospital. I said, why?
Oh my goodness.
So, I mean, the things that you don't know when you first get diagnosed, because lupus can affect everything, and you don't know that.
That is true. Very, very true. Yeah, lupus can affect you from head to toe. So just remember that, head to toe. And one of the diagrams that I gave you in your binders shows you where lupus is attacking. You know, your brain, your heart, your lungs, your kidneys, your skin. It affects your thinking. I just always like to say head to toe because it could be anything, right? Does anyone else want to share?
I'll just make a general comment that a lot of times, being a person that has been a patient for so many years, I forget that things have happened, or I forget that something's important to share. Happened to me recently, actually, but I think that one of the things that really helped me was I literally sat down one day and on 3 sheets of paper typed out all of my diagnoses and all of my symptoms over the years and every little piece of pertinent information I could, so that before I go see a new doctor, I just sit and I read it and I refresh my memory.
Oh, that's great.
Because I really non-intentionally left out things that
True.
are very important.
True. Very
you just
good.
forget. You have so much, so it's a huge history and you can't remember it all.
Exactly. And especially if you have kids too. Sometimes you're remembering all your kids or your husband's stuff and then you forget your stuff. So that's a great idea. I don't know if any of you ever download your labs or any little progress notes from your physicians or get a copy of it each time you leave. I always do that because I just want to know what they think, because sometimes, they forget to tell me something, in the clinic visit. So I'll get my labs and I'll get their progress note just to reread it, just to really understand what's going on with me and what I need to do. And then if I don't know, if there's something in there that I don't know or understand, I call the nurse. Can you help me understand this? What does he mean right here? Why does my lab say this? Am I okay? Do I need to come back? Why am I changing my medication? What's the plan? If I ever walk out of a doctor's office and I don't understand that, I will call back to the nurse. Did someone else want to mention? That is very true. Unintentional or intentional, it just happens. Yes, ma'am.
I usually journal and write down everything that's wrong with me, but I kept forgetting to write down that I was losing my train of thought and that I couldn't remember what was happening. And I kept forgetting to tell him. And finally he was like, that's because I'm like, I think I have a cognitive dysfunction for real. He's like, no, it's your Topamax. He's like,
your medication.
But you've been on Topamax for 12 years. You got to get off of it. It's taking away your memory.
Mm-hmm. Yeah, see, there's medications that you may be on also. Yeah, so these little things that we just So we just typically just adjust to, these are important things to mention to your physician. Okay, tips for communicating. Okay, so in your journal or in your phone, you can just make sure you write down your symptoms, your questions. And I like to do like the night before, like I may know I have an appointment 3 months from now. Okay, well, I'm just kind of monitoring myself until I get to the doctor appointment, right? Well, that night before, and I'll use some tools or journal or whatever, I'll think back at least 10 days. What has happened that has really bothered me, that didn't really require me going into the doctor's office? Now, if there's something going on, you're experiencing a symptom, you're going to call your doctor right away if it's pretty bad, right? Or you're going to go to the urgent care. But I'll think back at least 10 days so that when I'm in front of that physician in that limited amount of time, I can share, I had this symptom, this symptom, this symptom, but I have questions. Why am I having these symptoms? What's going on? Is my treatment working? Do I need to wait a little bit longer because some treatments take a while to start working? So yeah, I really teach my patients also in my area to really try to plan for your doctor's appointment as if you're going to a meeting. Because that way you have everything that you need and you can go and talk to your physician, in a very concise manner, and also mention what is your quality of life like. And the reason I say that is because doctors listen. They tune up when they hear about quality of life issues. They really want to make sure you're having the best life that you can. So make sure you mention, I haven't been able to go to dinner with my friends. I haven't been able to go to my kids' ball games. I haven't been able to do things with girlfriends. I haven't been able to do things with my husband, or things in the house. I haven't been able to clean like I typically do. Those are the kinds of quality of life things that your physicians or your nurse practitioner needs to know so they can make sure that your medications are working. And the National Patient Safety Foundation came up with 3 questions that I think could help you when you're journaling or when you're, getting ready for your doctor's appointment, and even while you're in your appointment, you want to know, what is your main problem? So what is the biggest symptom or complaint that you might have that you want to review and discuss with your physician? Maybe it's your rashes. Maybe you have more rashes than you've ever had before. That's something you really want to mention to them. You want to understand, why am I having these rashes? Do I need to do something different? Or I'm having more gross fatigue than I've ever had before. Why am I having these symptoms? What do I need to do? Is my medication working? Is my treatment plan working? So I love these 3 questions because they really kind of get you in that mindset of being prepared to have a conversation with your healthcare team. Again, education is important. You're doing it. You're attending these conferences. So always educate yourself. Always try to go to your support groups that are local and in your area, because you learn from each other. And sometimes symptoms that come up too, this is some symptoms that you may be experiencing that you've never experienced before. You may learn that someone else is experiencing it, and it is part of lupus. Again, any new symptoms or any symptoms that disappeared, jot those down. You want to have conversations with your doctors. I'm pretty sure all of you are used to the different blood tests that they're doing when you go into your appointments. So basically they'll check your urine to make sure your kidneys are functioning well. If you have questions about why they're doing some of these lab tests or urine tests, ask them. They'll explain it so you can understand why you're having these tests done each time you go into your doctor's appointment. Whoops. Okay, journaling. So we talked a little bit about the journaling here. So make sure, write your symptoms, write your questions, talk about things that you're not able to do. If you're just going to work and coming home and collapsing on the couch, that's something you want to mention to your healthcare team, okay? You don't want to be isolated. And if you do feel isolated or you do feel depressed, that's a good time to call your doctor's office and talk to them about how you're feeling and that you may be feeling isolated or you may be feeling depressed, so they can help you. You don't want to go down that dark road. You want to get help first. So make sure you communicate with your healthcare team and you let them know how you're doing. Let's see. I think we already asked those questions. So now I'm going to go into the resources that we have. First of all, you are the best resource. You are the best resource for your best outcome. Do you want to come on around? Yeah. You have your healthcare team, you have LFA, you have usinlupus.com, and I want to show you that. It's Us in Lupus is our campaign, and what it is if you have Facebook, if you pull up your Facebook and you put Us in Lupus in it, whoops, mine just disappeared. So you do a search in your Facebook or Instagram, you'll get this page that comes up. And what you can do is you can like the page and then you can sign up for our free resources. And we have dictionaries. You get this free journal, which is really nice. It fits in your purse or your briefcase. You get this whole series of how to communicate. And it's a really nice series that comes in the mail. I think there's actually 4 or 5 or 6 of them, but I only brought 3 because somehow my other ones have disappeared. But they're nice little booklets that you can actually, it helps you kind of self-reflect, and it helps you to really have a much more productive conversation and feel comfortable and feel empowered when you're talking to your doctors. So I love these resources right here. You get more like checklists, impact trackers. I think you have those already in your binders. I went ahead and brought those to you guys, so they printed them and put them in your binders. But yeah, check it out. It's free, and I don't want any of you to miss out on the free resources, okay? So yeah, Us in Lupus. Let's see, what else? I gave everyone one of these. It's 10 facts. I love these 10 facts like this because you can share them with people around you so that they can get a better understanding of lupus. So I put one in everyone's chair, so please be sure to take that. And then in the corner down here, it starts to show you some of the resources that are available. The other thing is, if you don't have Facebook, there is a card that you can put on here. And you just fill it out, and then you just tape it up, and then you just mail it in the mail. And it will take about 6 to 8 weeks before you start getting the mailings. And then once you get the mailings, about every 2 weeks you'll get another mailing, okay? So they kind of spread it out, and it's a nice little program to be part of. And you can share that with the people around you so that you can try to help the people around you who may not understand lupus. You can help educate them as well. Okay, that's Us in Lupus. So does everyone know Us in Lupus? Us in Lupus? Okay. You can go also to usinlupus.com if you want to go to the website versus the social media or mailing a card in. Okay, so in your binders, there's a checklist. This is really cool. You can use this the night before your appointments, and you can think back 10 days, and you think about, let's see if I can spread this up. You can think about your symptoms, and you can just check off what you've been experiencing. That way you won't forget when you get in to see your physician or your nurse practitioner. So it's really cool. Is anyone using something like this already, a checklist, before they go to their doctor? Okay, I'm glad I brought you one. So also there's an impact tracker. This really gets into your quality of life, how you're feeling, how you're doing. This is a good one also, and it's in your binder. So just pull these out. You can photocopy them if you like. And just think about this, the night before you go into your doctor's office. And these 2 sheets I think are awesome, and I think they'll really help prompt you so that when you get in there, maybe you won't forget something before you leave your doctor. Here's the My Lupus Log. See how easy that is? It'll prompt you and ask you questions, how you're feeling, how you're doing. And then it will also, if you're having a good day, you just check, I'm having a good day. And then you can look at all of this information that you put in right before you go into your doctor's appointment. And also you can even share it with your doctor. Okay, the Lupus Journal, like I showed you, this right here, this comes in the mail. This is the first thing that comes to you, this and a dictionary. And I love the dictionary because it's a bunch of terms that are used in the doctor's office. And what you could do is you can have this and the dictionary in your purse or in your briefcase. And then if the nurse or doctor says something, you can just look real quick and see, okay, I know what they mean. Because medicine has some funny terms for some of the things that are just most common to us, like hair loss is alopecia, okay? to walk, that's to ambulate. I mean, so sometimes medicine has some funny terms that we don't understand. So yes, so I definitely advise you get that dictionary. Also, you'll get one of these. I love this too. It's just a reminder of how to prepare for your appointment. And one of the things I love on here is make sure, if you have any medical records that your doctor or nurse needs to see, get those and have them in your hand. And also, always carry your medication list. We put also in your binder, I think you got a medication list guide that looks like this. I love this tool because what this tool is you can put all your doctor's names and phone numbers here, and then you can put all your medications with the doses and how you take them on here. And this is just an easy little piece of paper. And when you go into the doctor's office, you can have the office photocopy it for your doctor. And each time you update it and each time you go back, you can give it to them. So then they know who all your doctors are and they know your current medications. When I was practicing in vascular surgery, a lot of patients just didn't remember what medications they were on or what the dosage was. And that's really, really important for your physician and your nurse practitioner.
I need more room than that.
You need more. You can photocopy it multiple times. Yeah. I've seen people, they've even made, taken this and made a, Excel spreadsheet to keep track of their medications and their doctors. So whatever works for you, these are just some ideas. And you can just, like I said, maybe take what's on here and just create a document that you can constantly add to. Okay, so here's the dictionary. It comes in like an accordion. And then, like I said, you can just stick it in your purse. And when they walk out of the room, you whip that thing out and you look at those terms that they just said that you don't understand. But if you really don't understand a word, please ask because they will explain it to you. So do you think any of these tools may be helpful or something that you might use going forward to help you get ready? Was there any one that was your favorite that you noticed?
I like the symptom checklist.
Yeah, that's easy. I like that too. You like that? And she likes the Lupus Log.
I like it online, the security part.
You like it online? Yeah. It's easy because it's just in your phone. Your phones have a notes section also. You can put the date in there and then you can just write down how you're feeling each day, and then you can just pull that up when you're seeing the doctor as well. So there's all kinds of ways and everyone has their own little tracking way to do things. So does anyone want to share real quickly? How are you tracking something? Like she's using the My Lupus Log, but when you go into the doctor's appointment, do you just go empty-handed?
Notes on the phone.
Notes on the phone? Okay.
So because I take so many pills, the Lupus Foundation does have a Lupus app, and I love it because whenever I'm at the emergency room, when my family's here, they say, what meds is she on? Just hand me the phone, and it was
Love it.
not only the medication, but the dosage and how often you take it. Also on it, on that particular app, it gives my doctor's names and phone numbers and
Love it.
hospital affiliations. Because why am I at the emergency room? Is it my nervous system? Is it my heart? Is it why am I there? What issue? So they can refer back to that doctor. So technically, lupus patients should stay away from emergency rooms.
Yes.
Unless there's blood.
Yeah.
Because they really don't know what to do with us. But in the event of an emergency, they need to know that you are a lupus patient and they should be making phone call powers that be who they can have a conversation with so that no damage is done.
Exactly. So now how would they get that app?
It's
Lupus Ohio.
Lupus Ohio. Okay, good. Okay, so did everyone hear that? Lupus Ohio. And that's a really good, that's really great feedback right there because you don't want to just show up into an ER and then try to let them figure out what's going on because you'll start having all kinds of tests done that may be unnecessary or they may be going down another pathway because lupus can mimic many other diseases. So this is such a great tool with the online, as she mentioned, or on paper. Sometimes I'm old school and I like paper, but I'm getting there. I'm starting to use more and more apps. And just so they know, like, what doctor to call, like a heart doctor or a lung doctor or your kidney doctor or, whoever. Because, when you're a lupus patient, you have lung, kidney, heart, eye doctors, skin doctors, dermatologists. And that's a lot to remember when you're in the middle of like a little crisis, right? So you want to make sure that you have the information for your healthcare team so that they can go ahead and give a call to these doctors and figure out what's the plan of attack when you do show up in an ER. But no one's going to show up in an ER. I'm hoping everyone's going to be very healthy and they're going to communicate with their physicians and they're going to feel comfortable to call their physicians anytime, because sometimes I know we get nervous because we don't want to bother our doctor's office, but please, call your doctor. It's better to just call them than to be at home and something really bad happens. Okay, so remember, you're not alone. You have a great chapter here. I mean, it feels so warm and welcoming. So you have a really great chapter, great leaders in your chapter. So just always go to their events, always reach out to them. Don't be embarrassed to ask for help. Use your healthcare team. And remember, talk to friends and family. Tell them what you need. Tell them how you need some help. Sometimes they just don't understand if you don't want to do something. Maybe just you don't want to go anywhere and you don't want to do anything. You just let them know that's why. You're not feeling your best today. You're having a bad day today. Know that you can play an important role in managing your lupus. So always have open and honest communication. Take advantage of these tools, and also stay active and continue to educate yourself at these seminars. Sounds like you guys have like 10 or 14 summits coming up, so try to go to these summits, Just a couple, yeah. Try to go to those summits. Continue to be educated, and hopefully maybe I'll get to come to one of your walks or another event and see you guys there. I want to hear how everyone's doing. So does anyone have any questions, or anyone want to share one thing they might want to do as they leave this conference? What's one new thing you may do or change in the way you're managing your lupus? Anyone?
Point out.
Yes.
With what you presented. So
Okay.
Documenting your signs and symptoms,
Yes.
knowing where your doctor, your medication list, your physicians are. It's great that you're documenting them and putting them down, but letting someone know where they are to access them.
Good point. Very good
You
point.
have all these great tools, but if you're not able to speak for yourself, at least a family member or that care provider
Exactly.
knows where to go.
Exactly. Did everyone hear that? When you're documenting your signs and symptoms, and this is a great tip here, whenever you're documenting, whether it's on your phone or you're doing it manually on paper somewhere, make sure you let someone know in your family where these documents are, or where you're documenting this in the event that an emergency happens, or when you're going to the doctor's office, at least they know where to gather this information if you're not able to point them in the direction. So make sure you let people know, because that would be terrible if you have all this stuff written down and you end up in the hospital or in the doctor's office and you don't have any of it with you. So let someone else know. Very good tip. Yes.
The hospital I go to, they have something called mychart.com.
Yes.
So if you set up an account with that, you can access all your doctor's appointments and medical things.
Yeah, I love that. There's a lot of patient charts now that you have access to, and typically your doctor's office or hospital will email you, and you can log on and set up an account, and all your labs and all your reports will go into, it's typically called MyChart, I think. Yeah. So if you want to do that as well, that's another way to get your documents.
So if you went to the emergency room and the emergency room doctor didn't know what was going on with you, you could give that information to them, and they could access your chart, couldn't they?
They could if they're linked to the same system that you've been going to. Yes, exactly. So, very good. Yes, ma'am.
We had a paramedic come and talk to our support group, and they said that if you would put all your prescriptions and instructions in a pill bottle and put it on the refrigerator, that you have it, and you actually just put it in the refrigerator, then that's the first place they look when they come in.
Oh, that's a really good tip. Did you guys hear that? Apparently you guys had a paramedic come and speak one time at a support group, and the paramedic recommended to put all your prescriptions on your refrigerator.
The pill bottle and refrigerator.
And put the pill bottles in your refrigerator.
spot.
Okay, so that if an emergency happens and you call 911 and paramedics show up, paramedics, I guess, are trained to look at the refrigerator and look in the refrigerator. So make sure you have your medications not stuck in a drawer in one room and stuck in a bathroom in another room. You have them all together. That's a good idea. The list, yeah, the doctor's list, yeah. Inside a pill bottle. Okay, like an empty pill bottle? Okay, so she's saying write it all down and put it inside the empty pill bottle and put those pill bottles in your refrigerator. That's a good idea. That's one location.
The other thing we have at the office, if you call us for it, we have little magnetic ones that go on the outside of the refrigerator that you can put it in.
Love that. Love that.
Or in the visor of your car.
Love it. That's a good idea.
Your spouse can get those. The biggest problem is those who care for you or that are around you, when you're not able to speak for yourself, who's going to speak for you? So they need to be equipped.
Exactly. And sometimes we don't think about that. So that's a really good idea. I hope everyone has someone, a significant other or a relative that knows where your information is. Okay. Well, my part is done. I don't know what the next step is, so I'm going to turn it back over to Adrian.
Everybody, thank you.
Thank you.